It's hard to come into work some days knowing that you're short and knowing that you're going to see people die.
I've seen more people die in the last 7 days than I've talked to my own family members. Things were steady. And then all of a sudden, boom, we're seeing community members coming in. They can't breathe anymore, so they come into the hospital. And it just seems to be nonstop.
These reports from the trenches are just devastating, with hospitalizations hitting yet another record high just today. Frontline workers increasingly overwhelmed, making the need for a vaccine all the more crucial. Again, we say this again, hospitalizations have doubled since November 1, tripled since October 1. As we mentioned, healthcare workers will be first in line, and deservedly so. As to when that will be, the head of the FDA offered this assurance today.
And we've made a promise to the American people that we're not going to do shortcuts here. No one at FDA is sitting on his hands or her hands. Everybody's working really hard to look at these applications and get this done. But we absolutely have to do this the right way.
Dr. Stephen Hahn, interviewed by ABC News. For more, we welcome to the broadcast Dr. W. Ian Lipkin, a physician with expertise in diagnostics and outbreak response. Back in the 80s, he was involved in key research during the AIDS epidemic. He is these days director of the Center for Infection and Immunity at Columbia University School of Public Health. Doctor, it's great to have you on the broadcast. Let me begin with this. Should government make a vaccine like this mandatory, or are folks like you left to hope that enough employers make it a condition of employment?
That's a very difficult question. There is precedent for making vaccines mandatory, and I think that there are very few people for whom you could make the argument that a vaccination would be dangerous. We're doing everything that we can to make certain that the vaccines that are approved have been vetted, have been tested, and there will be ongoing surveillance to ensure that if there's something that we haven't anticipated, that we will recognize it in time. But my own personal view is that this should be mandatory.
Does scarcity help in your line of work? Does scarcity help to increase the number of people who want it? There's nothing like the human nature of hearing something is scarce, something is a limited edition running out, to make you go out and get it.
That's an interesting approach, and I wish it would work, but there are many people who don't have confidence in these vaccines. This is something that we're wrestling with, trying to find ways to persuade people that we've done everything we can. And this is one of the reasons why the FDA Commissioner Hahn, has said that we are leaving no stone unturned to ensure that these vaccines are as safe as they can possibly be. So I think the scarcity argument is a good one, and it may work, but there's still many people who need to be persuaded. We're having difficulty persuading everyone to wear a mask, as you know.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.